Hi, my name is Dr. Ken Bermudez, and I'm a board-certified plastic surgeon. I practice in San Francisco, and I've been using EarWell since January of 2011, and I tell you, it's been wonderful. Over the last year, I've approximately placed 30 to 35 EarWell systems, and the results have been dramatic. In fact, I've even placed them on my own daughter, who was born in August of 2011. This is my daughter Sienna at 2 weeks on the left side of your screen. And we shaved her hair in preparation of placing the ear wells. The problem she had at 2 weeks is that she had deformity of the rim of her ear. You can see it here highlighted right along the edge of the ear. It was folded over, it was irregular, it wasn't round. The other thing she has is that the cup is irregular. You see this little piece of cartilage going through the middle of the cup? Well, that's abnormal. It's called a third crus. And so we placed the earwell in order to try and correct all of these deformities. And the earwell is a non-surgical appliance. We do have to shave the hair, but it all grows back. And here she is today at 6 months with a nice rounded shape to her ear. That elf ear is now gone. And you see that the cup has some depth to it, and that cartilage that was crossing the middle of the cup right here is essentially gone. So a really nice result that I could never have achieved surgically. This is, for me, an impossible result to achieve with a surgical operation. So another important thing about these devices is that it prevents surgery at a later date. And I get a better result with the earwells than I do with my surgical otoplasties. So surgical correction of ear deformities doesn't get as good result as non-surgical intervention early on. The other thing, and the thing to remember, insurance companies will cover your earwell. They will not cover your surgical correction of ear deformities when the kid becomes 5, 6, or 7 years of age. Finally, I wanted to show you the difference between my son and my daughter. They had basically the same ears at birth. I did not have the earwell for my son, but I did for my daughter. So this is my daughter. This is today at 6 months with a nicely shaped, nice and flat ear that looks totally normal against her head. And this is after earwell application. And now I'm going to show you a picture of my son, who has really prominent ears sticking way out with conchal cups that are really visible. The cups of the ears really stick out, and I wish I'd had the earwell for him. He's probably going to need surgery when he reaches about 5 to 6 years of age to correct his prominent ears.